Hello everyone. So we are starting a very important LRR of forensic medicine, INI-CET exam. I try to cover maximum topics for you, and this is going to be big boost for your exam. Almost every topic is covered. So start with first slide, the types of court and what are the punishment of different court. And a very simple trick. These are the four court. What are these four court? Supreme Court, High Court, Session Court, Additional Session Court. Friends, the maximum punishment given by these court is death sentence and unlimited fine. Death sentence and unlimited fine. Now, sir, if you see the remaining court, these are the four court. Assistant Session Court, yes. Chief Judicial Magistrate Court, First Class Judicial Magistrate Court, Second Class Judicial Magistrate Court. अभी पहले वाले चार का क्या बोला था? सुप्रीम, हाई, सेशन, एडिशनल सेशन, डेथ सेंटेंस एंड अनलिमिटेड फाइन. Here the maximum punishment 10 year, 7 year, 3 year, 1 year. This is the maximum punishment 10 year, 7 year, 3 year, 1 year. And if you see the fine, for second class it's a 5,000 rupee. For the first class it is 10,000 rupee. All remaining, yes, all remaining it would be unlimited fine. All remaining would be unlimited fine. Second class 5,000, first class 10,000. All remaining unlimited fine. This is a very simple explanation. Now, sir, I am coming to the evidences type. What are the types of evidences? Now, sir, it's a very simple example. If A killed B, if A killed B, and C has seen the crime. C has seen the crime. C is a direct evidence, or I would say eyewitness. Direct evidence or eyewitness. This is direct evidence or eyewitness, which directly proves the fact. Now, sir, what happened next? Listen very carefully. Now, the C came outside. C came outside, and C told the whole story to D. This D is hearsay witness, क्योंकि इसने सुना है. This D is hearsay witness. C is direct witness. D is hearsay witness. And my dear friend, this hearsay witness is a indirect evidence, because you heard something and saying something. This is a indirect evidence. Now, sir, what is corroborative evidence? Now, A came out with knife. A came out with knife, and the E has seen this A. E has seen this A. So, my dear friend, this E is a corroborative evidence, and corroborative evidence is also a indirect evidence. Direct evidence, eyewitness. Indirect evidence, hearsay evidence. Corroborative evidence is another indirect evidence. Because if A came out with a knife and this E has seen that A person, that is E is a corroborative evidence. And you must be thinking, sir, what is a circumstantial evidence? What circumstances tell you? That is a circumstantial evidence. Very important. So these are the evidences. Now I am coming to two type of witness and two type of lawyer. Sir, first, this is a combination of public witness and public prosecutor, and this is a combination of defense lawyer and defense witness. These two belong to same party, and these two belong to same party. Okay. So now Dr. Sahab, these are three type of examination. Listen very carefully. Three types of examination. ध्यान से सुनना. Number 1 examination, chief examination. Number 2 cross examination. Number 3 re-examination. If same party lawyer asks question to the same party, it means that I am giving a very simple explanation. If public prosecutor asks question to the public witness and defense lawyer asks question to defense witness, yes, this one. This is chief examination because it is same party. So if defense lawyer asks question to defense witness, public prosecutor asks question to the public witness. Now, what is cross examination? If it is by opposite party, very important. So if defense lawyer asks question to public witness and public prosecutor asks question to defense witness, it is a cross examination. And my dear friend, in cross examination, leading question is allowed. Now you must be thinking, what is leading question? Leading question is any question which has answer in yes or no. Same party examination, chief examination and re-examination, opposite party is cross examination. Leading question are normally allowed in cross examination. Okay dear? चलो आगे चलते हैं. Sir, this is a very important body, Davidson body. You can see this is a drumstick shaped body. Drumstick shaped body is a Davidson body. So here it is, you can write down, it is a drumstick shaped body. That is a Davidson body, and it is present in your neutrophils, and it is present in female. The Davidson body is a drumstick shaped body present in neutrophils of female. In the same manner, there is a bar body that is also present in female. This is Davidson body. Now, sir, two word, study of death. Friends, study of death, this branch is known as thanatology. Study of death, this branch is known as thanatology. And study of post-mortem changes, my favorite MCQ. Study of post-mortem changes, this branch is known as taphonomy. Thanatology, Thanos, god of death, study of death. Taphonomy is a study of post-mortem change. Now, sir, this question comes in exam. This is a one post-mortem change. This is Kevorkian sign. If you see, Kevorkian sign is retinal vessels fragmentation. It is retinal vessels fragmentation. है ना, retinal vessels fragment हो जाती है. This is also known as railroad sign. This is also known as railroad sign or cattle truckling sign. Friends, this sign is seen in eye, and this is the earliest postmortem change of eye. Earliest postmortem change of the eye, and this image according to me is a very important image. This is a Kevorkian sign, railroad phenomena, cattle truckling sign. Now the next one is Tekenoir. Friends, this is Tekenoir of the sclera part. And how would you remember? T for Tekenoir, it is generally seen after 3 hours of the death, TT, and it is triangular in shape, another T, triangular in shape. This is yellowish in color. So the first color is yellowish, then it becomes brown. Yellowish, then it becomes brown. This is known as Tekenoir. Tekenoir. Another important change after death. Now, sir, my favorite MCQ, थोड़ा ध्यान से सुनना, गलती मत करना. Postmortem lividity, yes, the first name. Postmortem staining, yes, second name. Vibices and sugillation. Friends, the next slide is postmortem staining. Postmortem staining, postmortem lividity, vibices, sugillation, and my dear friend, it is also known as hypostasis. So you can get a question, what is hypostasis? Hypostasis is another name of postmortem staining. Another name of postmortem staining. Now, sir, these present in dependent area, absent in pressure area. What is pressure area? Which is touching the ground. And what is dependent area? Slightly elevated. Like see, this is dependent area which is slightly elevated. So here postmortem staining will be present. Now, sir, this staining is because of deoxyhemoglobin and because of venous pooling. Why because of venous pooling? Because dependent area are slightly elevated. थोड़ा सा उठा हुआ होता है. There will be gravitational force. There will be gravitational force in this dependent area. The pressure area is touching the ground, so it will be absent. So any area which is touching the ground, it will be absent, and the area which is dependent, slightly elevated, there will be bluish purple. Doctor, this question also comes in exam. What is the color of postmortem staining? It is bluish purple because of deoxyhemoglobin. And don't forget, ये मत भूलना दोस्तों, this is hypostasis, postmortem staining, postmortem lividity, vibices, sugillation, liver mortis or hypostasis. Now, sir, in moving body, it is absent. In moving body, it is absent. And sir, in hanging body, see this body is hanging, very, very important, sir. In hanging body, it is present in this area. In hanging body, it is present in hand and feet. And this question comes in exam. This is known as glove and stocking pattern. In hanging body, there will be in hand and feet. This is known as glove and stocking pattern. In moving body, there is no gravitational force, so it would be absent. Very, very important word, sir. Rigor mortis. The mechanism of rigor mortis is ATP depletion. This question comes in exam. This is the stiffening of muscle. The first muscle where rigor mortis develop is myocardium. First muscle is myocardium, involuntary muscle. But first external muscle is upper eyelid. First external muscle is upper eyelid. Upper eyelid. First overall muscle is myocardium. First external muscle is upper eyelid. And from upward, it goes downwards. Looks very simple. From upward, it goes downward. This is known as Nisten law. Now would remember, ऊपर से नीचे जाती है, ऊपर से नीचे जाती है, नीचे जाना, that is a Nisten law. Upward to downward, this is known as Nisten law. This is rigor mortis. Cadaveric rigidity, not cadaveric spasm. Now, sir, this is cadaveric spasm. This is seen just after death. Rigor mortis is not seen just after death. It is seen just after death. So here, primary relaxation phase is absent. But it is not seen in all muscles. It is seen in few muscles which are in action. And it is very, very common in drowning. It's a very important sign of antemortem drowning. So when you contract the muscle which is in action, and my dear friend, it is a postmortem change, but the event is antemortem because the contraction starts when you are alive. If you get a question, which one? Cadaveric spasm is a postmortem change, but it is an antemortem event. ये दिखता तो as a postmortem change है, but आपका जो contraction है ना, वो antemortem ही start हो गया. This is cadaveric spasm. The mechanism of cadaveric spasm is again ATP depletion. ATP depletion. Now, sir, marbling. Marbling start after 24 hours of death. Yes, marbling starts after 24 hours death, maximum in 36 to 48 hours. It is also greenish brown color of the veins. Greenish brown color of the veins because of sulfa hemoglobin. This question also comes in exam. Because of sulfa hemoglobin. And what are the sites of marbling? These are the superficial veins. Sulfa hemoglobin पे पक्का question आता है. 24 hours में start हो जाती है. Maximum in 36 to 48 hours. These are common in your chest, shoulder, and abdomen. These are common in the chest, shoulder, because the superficial veins are distended. This is marbling. My dear friend, marbling should be differentiated from filigree, arborescent, and Lichtenberg bud. And Akshav, how would you remember? I am telling you. F filigree, A arborescent, L Lichtenberg. This is lightning injury. Lightning is a bijli. Bijli fall on your body. FL fall. Filigree, arborescent, Lichtenberg. और lightning की क्या fall हुई? किरण for keranographic bud. Sir, lightning doesn't correspond to the vascular channel. This question comes in exam. These are pink and erythematous in color. Branching tree pattern. Can you see? This pattern is branching tree pattern. This pattern is branching tree pattern. So all the line I am telling you, my dear, pink, erythematous, branching tree pattern. Air compression. This question I am putting. Air compression is always in front part of the lightning. And it has to be differentiated from marbling. देखो ध्यान से देखो. Pink होता है, erythematous होता है, branching tree pattern होता है, air compression is always in front. And how would you remember? बिजली आप पे गिरी, FL fall, F filigree, A arborescent, L Lichtenberg, और बिजली की किरण गिरी, keranographic bud. This is a lightning bud. Has to be differentiated from marbling. Maggots are larvae of the fly, sir. These are seen after 1 to 2 days. In rainy season, it comes early, and the study of maggots is known as entomology. Only 2 words आपको यहाँ से pick करना. Maggots को बनने में कितना time लगता है? 1 to 2 days, and in rainy season it is early. Study of maggot is entomology. So these are the stages of maggots and flies. You can see the first is maggots 1 to 2 days, then pupa 3 to 6 days, and then adult 3 to 6 days. 1, 2, 3, 6. That's a trick you can remember. That is very common. In 5 to 10 days, the all stages of the fly comes. Okay. So this is maggots. As I already told you, the study of maggots is known as entomology. मार्बलिंग ध्यान रखना 24 आवर्स मैगट्स 1 to 2 days पक्का याद रखना आपको स्टडी ऑफ मैगट्स और द इंसेक्ट ऑन द बॉडी इज एंटोमोलॉजी ओके डिपेंडेंट पार्ट में पोस्टमार्टम स्टेनिंग होती है जस्ट बिकॉज ऑफ डीऑक्सी हीमोग्लोबिन एंड द मार्बलिंग इज बिकॉज ऑफ सल्फा हीमोग्लोबिन एक लाइन रटी हुई होनी चाहिए वेरी इंपॉर्टेंट वन जो एग्जाम में पूछे जाते हैं सर दिस इज एडिपोस हियर यू कैन रिमेंबर ए फॉर एडिपोस हियर ए फॉर अमोनिकल स्मेल this is you can see A for adipose here, A for ammonical smell. Yes, adipose here is also known as grave wax or saponification. Grave wax and saponification. My dear friend, it is common in warm and humid climate. Pehla question. It is common in warm and humid climate. Second, it is common when the body is in water. Now, third question में मैंने question mark लगा दिया आप बताओगे. What is the most common bacteria causing adipose here? Clostridium welchi. Clostridium welchi. The main enzyme is lipase. It starts in 3 days and completes in 3 months, or it can take sometime 3 weeks also. But India is a humid country, it starts in 3 days. Fetus below 7 months, adipose here is absent, and there is a smell of the adipose here in your clothes. It is known as pseudo smell. Anticipating this question in your exam, pseudo smell is a very important smell because the adipose smells is in your clothes when you are going for autopsy. This can be present. This is pseudo smell. 3 line ध्यान रखना warm and humid climate water or it is pseudo smell. Pseudo smell. Now sir, but if pseudo smell is not given, it's a pungent smell, ammonical smell. Mummification is in dry and hot climate. Mummification is adipose here था warm और humid में it is in dry and hot climate. Sir, it is also known as desiccation. The smell is odorless. वहां पे ammonical यहाँ पे odorless. You can see the body is dehydrated. This is mummification. Sir, arsenic and antimony favors mummification. So if you had a question, what favors mummification? Arsenic and antimony. Sir, natural feature of the body in mummification are preserved. What is the meaning of positive? These are preserved. So we can identify the body for a longer period. Natural feature of the body are preserved. You can see the dehydration of the body. और यहाँ देखो सर, in adipose here it's a greasy and translucent body. है ना थोड़ी चिपचिपी बॉडी हुई. This is dry body, dehydrated body. Odorless, वहाँ ammonical smell थी. एक लाइन को कंपेयर करते चलो. Warm और humid climate था, यहाँ dry and hot climate. Sir, criminal responsibility of juvenile. Now sir, what is the age of juvenile? If you get a question, the age of juvenile is any child below 18 years of age. Any child below 18 years of age is a juvenile. What is the minimum age of criminal responsibility? 7 years. Below 7 you are not criminal at all. But what is the age of full criminal responsibility? Because I told you, what is juvenile? Juvenile is a child below 18. अगर आप juvenile रहोगे तो आपको crime का responsibility नहीं माना जाएगा. So for full criminal responsibility it would be 18 years. Girls can give consent only after 18 because sir, if any girl 18 or above 18, if any girl below 18, even if she is giving consent, it would be a statutory rape. तो डॉक्टर साहब अगर कोई कहे कि गर्ल की सेक्स के लिए कंसेंट देने की एज लिमिट क्या है, दिस इज 18. दिस इज वेरी इंपॉर्टेंट. 18. जुवेनाइल इज अ चाइल्ड बिलो 18. Now sir, what is the age limit of testify in court? Now you must be thinking sir, testify का मतलब क्या होता है? The meaning of testify is evidence. What is the age limit of giving evidence in court? No age limit. What is the age limit of taking oath? Below 12 years of age, oath is not required. Now kidnapping for a boy and kidnapping for a girl. If boy below 16 and girl below 18 are taken away from parents, this would be a kidnapping. Okay, so these are different age for kidnapping for boy and girl. Very important, sir. Now sir, torture. How to remember TO for torture? It was given by Declaration of Tokyo, TOTO. Sir, for torture we use a protocol that is known as Istanbul Protocol. Istanbul Protocol is related with the examination of torture victim, that is the Istanbul Protocol. And आप ऐसे भी याद कर सकते हैं, Istanbul Turkey में it's a T for torture, T for Tokyo, T for Turkey. What are the type of torture? We are coming one by one. Yes, बीटिंग ऑन सोल इज फलंगा और बेस्टिनाडो। ऐसे भी याद कर सकते हो, सोल फुट पे होता है, एफ फॉर फुट, एफ फॉर फलंगा, ताकि आपको दिक्कत नहीं होगी। बीटिंग ऑन एब्डोमेन इट इज क्वीराफोना। बीटिंग ऑन ईयर, डॉक्टर साहब वेरी सिंपल, इन ईयर वी यूज टेलीफोन, टेलीफोना। सस्पेंशन ऑन द पोल, जैसे आपका ये पोल है, दिस इज अ पोल एंड द बॉडी इज सस्पेंडेड सराउंडिंग दिस। हाउ टू रिमेंबर? पी फॉर पोल, पी फॉर पैरेट पर्च, पी फॉर पोल, पी फॉर पैरेट पर्च, सस्पेंशन ऑन द पोल। सर इलेक्ट्रिक टॉर्चर यू कैन सी आईसी, आईसी पिकाना, आईसी, आईसी पिकाना, दोनों में आईसी है। बर्न, डॉक्टर साहब चिली पेस्ट इन एनल कैनाल, देखो हाउ टू रिमेंबर, बी बर्न, बी बेलरी, बर्न होगा बेलरी, चिली पेस्ट इन एनल कैनाल एंड hot rod in anal canal. That's a chili paste in anal canal is biliary. Hot rod in anal canal, that will be black slave. This both are B. याद करने की ट्रिक भी बहुत इजी है अगर देखो तो, both are B. Biliary भी B है और black slave भी B है और दोनों में burn होता है. That's a chili paste in anal canal is biliary and hot rod in anal canal is black slave. Crushing of the tissue. Doctor साहब how to remember crushing and the damage of the soft tissue. We crush the roti with belen. That's a belena. बेलन से क्रश करते हैं, दैट इज बेलेना। नाउ सर इफ यू सी द बम्बू, सी बम्बू स्टिक, सो बम्बू कॉजेज चेपू, चेपुआ, बम्बू से चेपू होता है, बम्बू कॉजेज चेपुआ। इफ यू यूज बम्बू स्टिक टू क्रश द बॉडी इट इज चेपुआ, इट इज चेपुआ, लेग एंड थाई आर क्रश्ड। नाउ आई एम कमिंग टू द इंसीजन ऑफ पोस्टमार्टम। मोस्ट कॉमन टाइप ऑफ इंसीजन इज आई शेप। आई विल शो यू द पिक्चर ऑल्सो, यू कैन सी आई शेप. It is the I shape. It is starting from the chin and going to the pubic symphysis. It is I shape. The most common incision is I shape. Doctor, female used to say why every time. जब भी आप female से मिलोगे बहुत ज़्यादा why करती है. That's a very simple trick. In female, Y shape incision is done. So it starts from the acromion process, then below this, then straight line. So female used to say why. It's a Y shape. Most common is I shape. Y shape start from acromion process in female. In asphyxial death, modified Y shape is done. And I am telling you the trick. M for modified Y shape, M for it start from the mastoid area. इतनी easy trick तो क्या होगी भाई साहब? It start from the mastoid area, then suprasternal notch, then straight line. I will show the picture also. In custodial death, we use X shape. And just remember, my dear friend, this X is made over the back. This X is made over the back. We will see the injuries over the back by making X. तो याद कैसे करोगे? Most common I shape. Female Y करती है, Y shape. Start from the acromion process. Okay, done. Custodial death X shape and modified M modified. It start from the mastoid process. You can see these are the incision. This start from the acromion process. This is a Y shape, and you can see this start from the mastoid process. This one, then straight line. It is asphyxial death. Doctor, remember. Modified Y shape is done in asphyxial death. Yes, this one. M modified, M mastoid. Just remember this. Custodial X shape. ये सब incision हो गया, done. Sir, postmortem technique. The most common technique is one virtuous method. How would you remember? Most common, very common method. One by one organ removal. If you remove organ one by one, it is virtuous method. Sir, in transmissible disease, we are doing Rokitansky method. Actually, sir, in Rokitansky method, we are not taking organ one by one. We are doing in situ method. It is inside dissection, like HIV. Like HIV. And also, how to remember? HIV spread like a rocket. Rokitansky method. Gon's method, sir. En bloc method. How to remember? GB. G for Gon's, B for block. Here we are removing block separately. Cervical block, thoracic block, abdominal block, pelvic block. This is Gon's method. Sir, en masse method is luteal. If we remove all the organ at the same time, doctor, how to remember? Luteal, L for luteal, L for large, L for लंबा, जो भी बोलना चाहते हो. अगर आप सारा मास एक साथ, cervical, thoracic and abdominal and pelvic, all are taken out simultaneously, it is luteal. देखो दोस्तों, one by one organ, one by one virtuous. In situ method, we are not taking any organ out. Rokitansky. It is Rokitansky. En block method, हम एक एक ब्लॉक निकालते हैं, cervical, thoracic, abdominal, pelvic. इन ब्लॉक को एक एक करके निकालते हैं, Gon's. और the complete mass, L for little, L for large, पूरा mass निकालते हैं, and mass it's a little method. So these are the 4 types of method. Sir, for criminal responsibility of insane, we use McNaughton rule. If the person is having unsound mind and defect of reason, person is not criminally responsible. That is a McNaughton rule. The second rule comes currents. C for currents, here mental capacity is lost. And third rule comes product or Durham's rule. In Durham's, we have DU, it's a product test. How would you remember? McNaughton rule, unsoundness of mind is there, defect of reason is there, person is not responsible. C currents, C capacity is lost, mental capacity is lost. DU, Durham's, DU product, DU may be product, product of mental disease. This is Durham's criminal responsibility. This one. So delusion of double. The first is Capgras syndrome. Second is Fregoli syndrome. How would you remember? Capgras AP अपना पराया हो जाता है. So Dr. you can remember the familiar look like stranger. AP familiar look like stranger, and if stranger look like familiar, it's a Fregoli. Infidelity syndrome or delusion of infidelity is Othello. What is infidelity? Your partner is not loyal. That is infidelity. Because if your partner is not loyal, you will say Othello syndrome. So infidelity delusion is Othello syndrome. And delusion of love, Bolt loves you. That's a trick. It's very common in female. Female को लगता है Bolt loves me. Declare Bolt syndrome. Delusion of infidelity, Othello. Bolt मेरे से प्यार करता है. Declare Bolt love वाला. और अपना पराया, Capgras, familiar look like stranger and stranger look like familiar. That's it. These are two. Now, sir, remember criminal responsibility after alcohol withdrawal. Doctor Sahab, alcohol withdrawal is known as delirium tremens. Here, person is not responsible because delirium means disoriented to time, place, and person. You are not responsible. Run amok is very common in cannabis. Doctor Sahab, what is run amok? You are having homicidal and suicidal tendency. You are not responsible. In kleptomania is stealing some article. So, if you get a question, what is kleptomania? If you steal some article, it is an impulse. But sir, here insight is present. What is present? Insight is present, knowledge is present. That's why you are responsible. These are 3 criminal responsibility. Sir, viability of fetus is 28 weeks, and it is the age after which fetus is capable of survival. This is known as age of viability. After this age, fetus is capable of survival. This is known as age of viability. So, what is the age of viability of fetus? 28 weeks. Okay. छोटी-छोटी बातें हैं sir. Radiological sign of dead bone. The first radiological sign is Roberts sign. Second is Spalding sign. Friends, as for Spalding sign, as for skull bone overlapping. So, if your skull bone is overlapping, it's a Spalding sign. The earliest sign is Roberts sign. It is gas in heart chamber and aorta. If you get a question, which is the earliest sign of dead bone? The answer is Roberts sign. Earliest sign of the dead bone is Roberts sign. Now, there will be overcrowding of ribs. Yes, my dear friend. Overcrowding of ribs and spine, because like you are dead bone, no respiration has taken place. Your spine is hyperflexion. These are the radiological sign of the dead bone. Dead bone means the fetus died inside the uterus. Earliest sign, Roberts sign. As for Spalding related with skull bone, ribs are overcrowded and spine is flexed. These are the radiological signs. Now, live birth test. Doctor, very simple. Live birth means respiration has taken place. Air in ear. E for ear, it's a Redin test. Very simple trick. Air in ear, it's a Redin test. Fodre test. Lung become two-fold. Two-fold Fodre test. Very simple trick I have made for you. After respiration, lung weight become two-fold. From 30 grams, it has become 60 grams. This is Fodre test. Lung weight and body weight proportion. Yes, my dear friend. P for proportion, P for block weight test. P for proportion, P for block weight test. Lung weight और body weight का proportion 1/70 से 1/35 हो जाएगा. Now, sir, 2 question comes. Breslau first live test and Breslau second live test. I am asking one question. थोड़ा ध्यान से सुनना. Lung or stomach, what is your first life? Lung or stomach, what is your first life? Sir, lung is your first life. So, air entry in lung, it's a Breslau first live test, an air entry in stomach or intestine, it is Breslov's second life test. And my dear friend, Breslov first life test is also known as hydrostatic test. Breslov first life test is also known as hydrostatic test. These are some tests for live boat. These are the some tests for live birth. देखो कैसे याद किया है. रेडिन में ई आता है, एयर इन ईयर. फोल्ड फोल्ड रेट, लंग वेट 2 फोल्ड हो गया. लंग वेट और बॉडी वेट का प्रपोर्शन पी ब्लॉक वेट. ब्रेसलव फर्स्ट लाइफ टेस्ट, सेकंड लाइफ टेस्ट, वेरी वेरी इंपॉर्टेंट सर. Sir, if female is not able to, so see, frigidity, I made a rigid, female is rigid. Female is rigid. Female is not able to start or maintain sexual arousal. That female is frigid female. That female is frigid female. Now, sir, what is the best ground of divorce? My dear friend, if you get a question, what is the best ground of divorce? And these three options are given. Sir, the first answer will be frigidity. First answer will be frigidity. Second answer will be impotence after marriage. If female is not getting sexual arousal, that's the best ground of divorce. Second, your husband is impotent after marriage. The third ground is impotence. So here only impotence is given. So if you are impotent before marriage, अगर शादी से पहले ही आप impotent हो, this is avoidable marriage. So the best ground will be frigidity. Dr. Sahab, sterility is not a ground for divorce. What is sterility? Sterility means you are not able to produce children. You are not able to produce children. So this is not a ground of divorce. Now, sir, posthumous child is any child born after death of father. Any child born after death of father is a posthumous child. Any case of disputed paternity, अगर आपको लगता है कि paternity or maternity disputed है, this is affiliation case. And if you are impotent for a particular person, if you are impotent, listen very very carefully, if you are impotent for a particular person, only for one person you are impotent, that means you are a quad. Posthumous child, child born after death of father. Disputed अगर आपके paternity और maternity पे सवाल उठ रहा है, that is a affiliation case. And quad if you are impotent for a particular person. Sir, superfecundation versus superfetation. If you have, listen, superfetation and superfecundation. Sir, in superfecundation we have 1T and in superfetation we have 2T. 1T means in same MC cycle and 2T means in 2 MC cycle. Done, sir. That is done. In same MC cycle, 2 ovar fertilize by 2 act of coitus by same or different male. It is superfecundation because fecundation has 1T. In 2 MC cycle, 2 ovar fertilize by 2 act of coitus by same or different male. It is superfetation. Fetation has 2T, 2 MC cycle. Sir, MTP Act everyone knows. For consent, MTP is medical termination of pregnancy. Consent is required from mother. But just remember the age of mother should be above 18. Generally, MTP done up to 24 weeks. Up to 20 weeks, MTP is done by one doctor. And 20 to 24 weeks, MTP is done by 2 doctors. So that is very, very important. Sir, unnatural sexual offense is 377 IPC. But sir, I would suggest now, don't remember IPC or don't remember the new law because these are going to be implemented soon. So we are not going to get any question from IPC or new laws. Anal sex, it is also known as Greek love or sodomy. Greek love or sodomy. And Dr. how would you remember? It is through buttock. So that's a very simple trick. BU for buttock, it is also known as bagri. Now anal sex between adult and child, C for child, this agent is known as catamite. C for child, C for catamite. The child word for sodomy is known as catamite. The sin of Gomorrah is a mouth sex or oral sex. Orally अगर आप लोगे तो गुमराह हो जाओगे. That's a sin of Gomorrah. Animal sex is with lower animal. It is known as bestiality. And sir, lesbianism is known as sapphism and tribadism. How would you remember? Lesbianism is between two stree, S for stree, S for saphism, T for tribadism. 3. Saphism and tribadism. Now, sir, sexual perversion is also known as paraphilia. Now, if you want to give pain to someone, it is sadism. But if you want to suffer pain, it is masochism. Necrophagia and necrophilia is with dead body. Eating the dead body is necrophagia. Sex with dead body is necrophilia. If you are showing your genitalia to someone, your private part to someone, it is exhibitionism. Now listen very, very carefully, sir. Transvestism. So what is the meaning of trans? Trans means opposite. Vest means clothes. If you are wearing opposite sex clothes, it is known as transvestism. Trans means opposite and cloth means vest. And also transvestism is also known as eonism. If you are wearing opposite sex clothes, it's a transvestism or eonism. But sir, if you are satisfied by opposite sex article, example, if male is satisfied with any female article, like male got a panty of female, bra of a female, that is fetishism. डॉक्टर साहब इसको ऐसे याद कर लेना, मेल को फीमेल की कोई फटी हुई चीज मिल गई तो उससे खुश हो गया, fetishism. It is article. कपड़े पहनना, यूजिंग क्लोथ्स, वियरिंग क्लोथ्स, ट्रांसवेस्टिज्म और इयोनिज्म. लेस्बियनिज्म के दोनों याद रखना. एल लेस्बियनिज्म लड़की वाला, स्त्री सेफिज्म और ट्राइबाडिज्म. बगरी वाला दिस इज सोडोमी. सीन ऑफ गोमोरा ओरल सेक्स. ये नाम पूछे जाते हैं, ध्यान रखना. ओके, नाउ सर, एफ फॉर फ्रोटिनिज्म, यू आर रबिंग ए फीमेल. FR, you are rubbing a female in crowded place, it's a frotinism. Any obscene mobile video call, very simple, obscene मतलब आप गंदा वीडियो कॉल मोबाइल में देख के सेटिस्फाई होते हैं, इससे स्केटोलोजिया. Nymphomania is excessive sexual desire in my favorite MCQ in female. Satyriasis is excessive sexual desire in male. D for dippoldism. How would you remember dippoldism? इसकी भी ट्रिक बता देता हूं. D for डंडा. टीचर बीटिंग द स्टूडेंट. डंडे से तो बीट करता है. टीचर बीटिंग द स्टूडेंट इफ सेक्सुअली ग्रेटिफाइड, इट्स अ dippoldism. It is dippoldism. D for danda. That's a very simple trick. These all are paraphilia. Now, sir, blood stain, my favorite MCQ. For blood stain, the first test is Teichmann. Man for imine crystal. Now, sir, we all know the color of the man is brown. So here the crystal will be brown. Teichmann, man, imine crystal. We use sodium chloride and glacial acetic acid for Teichmann. Man, he-man, color is brown. Sir, Takayama, which color is Takatak? Pink feathery color is Takatak. And here we use GPS. What is GPS? Glucose, pyridine and sodium hydroxide. But sir, here formation of hemochromogen. Imine Teichmann, hemochromogen, it is Takayama. More specific test for blood stain is spectroscopy. For species of, this question is very important. For species of blood, for species of hair, for species of bone, we do precipitin test. So as we have discussed, what are the tests for blood stain? Teichmann, brown rhombic, Takayama, pink feathery, spectroscopy, more specific. For species, we do this. Now, Dr. Sahab, this is Teichmann. You can see the brown rhombic crystal. This is Teichmann test. We use sodium chloride and glacial acetic acid. Teichmann, man का color क्या होता है? What's the color of the man? It's a brown. It's a brown rhombic crystal. Teichmann, man से याद कर लेना. Which color is Takatak? Pink feathery. अगर किसी का pink color मिल जाए तो it's a Takatak color. Takayama is a pink feathery crystal. Okay. We use glucose, pyridine and sodium hydroxide in Takayama. Pink feathery, Takatak. It's more important. Takayama, hemochromogen crystal. Sir, for what are the tests for semen? Florence, C, it detect choline crystal. Choline. And also you can remember choline, chole. What's the color of the chole? Brown. It's a brown rhombic crystal. This is for semen. Blood stain is already in. Barbeриоз. S for Barbeриоз. S for it detects spermine crystal. Barbeриоз, S, spermine detect. Spermine, it is spermine picrate. It's a yellow needle crystal. So how would you remember? Spermine picrate. So it's very simple trick. Barber use needle to pick the hair. Picrate, yellow needle shape. Choline, Florence has C, C for choline. Barbeरिoz has S, S for spermine. ताकि गलती होने कोई और बार बार येलो नीडल यूज करता है. कोहली का कलर दैट्स ए It's a brown rhombic. Most specific test for semen is LDH, lactate dehydrogenase. You can see this slide, Florence, it is dark brown rhombic crystal, but it is semen for semen. Doctor Saab, in Florence test, we use potassium iodide. What we use? Potassium iodide. Okay, Florence में C आता है choline, कोली का color dark brown. Barbados, S for spermine, very simple, sir. It is spermine, it is yellow needle shaped crystal. It is yellow needle shaped. Abrasion, loss of epidermis is abrasion. Loss of epidermis is abrasion. First abrasion is grazed abrasion, and my dear friend, grazed abrasion is also known as brush burn. It is most common in road traffic accident. Grazed abrasion is a brush burn. It's most common in road traffic accident. You can see this is grazed burn, grazed abrasion. Brush burn, it is not a burn, but it is known as brush burn because it look like a brush and it gives burning sensation. So if you get a question, most common abrasion in road traffic accident is grazed abrasion or it is brush burn. Abrasion is a loss of epidermis. This is grazed abrasion. Sir, this is scratch abrasion. Scratch abrasion is by nail and by thorn. This is scratch by pointed object. This is tire mark. Tire mark is also known as imprint abrasion, and my dear friend, it is also known as patterned abrasion. Tire mark is also known as imprint or patterned abrasion. There is an imprint or patterned abrasion. This is ligature mark in cases of hanging. My dear friend, ligature mark in cases of hanging, this is a pressure abrasion because it creates pressure abrasion. Pressure abrasion is a better answer. If pressure is not given, you can pick the pattern also, but pressure abrasion is better. If you get a question, ligature mark in hanging, first answer will be pressure. The second better answer will be pattern. Okay, these are the types of abrasion. Now, sir, I am coming to contusion. Contusion is a bruise. It's a damage of the dermis. Contusion is also known as bruise. It is a damage of the dermis. And observe, there is a sign which is a battle sign. There is a sign which is a battle sign. Battle कहाँ होती है? मैदान में. You can remember battle मैदान में होती है. It's a fracture in middle cranial fossa, but bruise is at mastoid tip. How would you remember battle मैदान में होती है? Fracture of middle cranial fossa, bruise is at mastoid tip. It is example of ectopic or migratory bruise. Why? Fracture at middle cranial fossa, bruise is here. It's ectopic or migratory bruise. Bruise is a bruise or contusion, both are same. It's a damage of dermis. It's a damage of dermis. This is raccoon sign, another example of the migratory bruise. Here, fracture in anterior cranial fossa, but bruise is periorbital. Bruise is periorbital. Again, it's a ectopic or migratory bruise. Sir, tramline bruise is a pattern bruise. It is created by or it is caused by lathi or road. It is just like a tramline or railway line. This is tramline or railway line bruise by lathi or road. It's a pattern bruise. This category of the bruise is pattern bruise. 6 penny bruise. Doctor, everyone knows penny is a coin-shaped bruise. Coin-shaped bruise are commonly seen in throttling. Coin-shaped bruise are commonly seen in throttling. 6 penny bruise. These are coin-shaped bruise. These are commonly seen in throttling. Throttling because there is a pressure. It's a throttling. Pinching bruise. If you are pinching the baby, the pinching bruise over the baby, it is known as butterfly bruise. It is known as butterfly bruise. All are pattern bruise. ये भी मैंने जो बताया, this was also pattern. Tramline जो लाटियो रोड से होता है, this is also pattern. 6 penny bruise in throttling, and pinching the baby will produce butterfly bruise. Sir, split laceration. My dear friend, this is split laceration. First of all, remember, it is common in hard surface by hard weapon. If surface is hard, if you see, what are the hard surface? Scalp, forehead, eyebrow, chin, iliac crest, shin or elbow. In the hard surface, if you are using hard weapon, this is split laceration. And my dear friend, this split laceration is also known as incised looking laceration. This is also known as incised looking laceration. Now you will say, sir, why it is known as an incised looking laceration? ध्यान से सुनना. Because in these area, the margins are regular. Regular means it look like incised wound. This is split laceration, incise looking laceration. Now, sir, any kind of separation is known as avulsion. Avulsion is also known as shearing laceration. Any kind of separation, and here generally the force is horizontal. You can see the force is horizontal. So, any kind of separation is avulsion. Avulsion is a shearing laceration. Shearing laceration. Sir, incised wound, it is also known as cut injury. And here in incised wound, fibroblast is seen in 48 to 72 hours. And you can see that telling at the end point. Telling at the end point. You can see this is telling at the end point. It is when you apply the weapon parallel to skin surface, it is incised wound or cut. Fibroblast 48 to 72 hours. Collagen, C for collagen, C for 3 to 5 days. But sir, here maximum dimension is length. As you can see, the maximum dimension of the wound is length. Collagen, याद कैसे करोगे? C collagen, C third letter है 3 to 5 days. Fibroblast 48 to 72 hours. End point पे थोड़ी depth कम होगी. This is known as telling. Now sir, there are two sides. अभी मैंने बोला था split laceration. This one was. Split laceration at few area it look like, as I told you, the bony prominence or hard surface. It is an incised looking laceration. In the same manner, my dear friend, in the same manner, there are two areas in your body. These two areas are axilla and scrotum, where incision look like laceration. It is known as laceration looking incision. It is known as laceration. देखो confuse मत होना. Hard surface in laceration, hard surface, that is hard surface, inside looking laceration. And axilla and scrotum, here incision look like laceration, laceration looking incision. And if you are confused, now just remember asli, A axilla, A scrotum, L laceration, I looking incision. That's very simple trick. Asli yaad rakh lena. Hard surface incision looking laceration, which is a split laceration. Sir, this is self-inflicted suicidal wound. These are superficial, commonly seen on the flexor aspect of the forearm. These are known as hesitational cut, tentative cut, or trial cut. These you are inflicting on your body. This is self-inflicted. But sir, you are taking help of some other person to get injured. अगर आप किसी और को बोलते हो बेटा मेरे को इंजरी कर दे, that is known as self-suffered. One is self-inflicted, another is self-suffered. किसी और को बोलते हो just injure me, that is self-suffered. Both are fabricated wound. दोनों को हम fabricated wound बोलते हैं, है ना? That's a very important one. Sir, stab injury, the maximum dimension of the stab injury is depth, because you can see it's a perpendicular. And observe, there is a suicide in Japan with a sword, and sword hitting the abdomen. They are hitting with abdomen sword. The cause of death is cardiac collapse. This is known as harakiri. This question comes in exam. Harakiri में कहाँ पे मारते हैं? That is in abdomen. Cause of death is cardiac arrest. This harakiri is also known as seppuku. This harakiri is also known as seppuku. It is cardiac collapse is cause of death. This is a stab injury. This is a stab injury. Doctor Saab, line of Langer correspond to the collagen fiber. This question comes in exam. A line of Langer correspond to the blood vessels or collagen fiber. The answer is collagen fiber. This decide the shape of the stab injury. This decide the shape of the stab injury. Now, sir, two questions: swallowtail and fishtailing in stab. Sir, swallowtail is seen in laceration. Swallowtail is seen in which injury? The answer would be laceration. Answer would be laceration. If you see this one, this is swallowtail. Fishtail is seen in stab. This is a triangular shape of entry wound of the stab, and there is a fishtailing. And remember, my dear friend, in fishtailing, the tail is because of blunt edge. Tail is because of blunt edge. Because the sharp edge causes this acute angle, tail is because of blunt edge. Swallowtail in laceration, fishtailing, tail is because of blunt edge. Be careful. So this is EDH, two question. E for EDH, E for exclusively traumatic. It is never non-traumatic. E for idly shape. E for it is idly shape. It is biconvex. So if you see, EDH is biconvex idly shape. Sir, here lucid interval present. Lucid interval. What is lucid interval? Listen very, very carefully. You are unconscious, then you become conscious, then again you become unconscious. And Doctor, here doctor can be charged for medical negligence. This question comes in exam. If doctor is not able to identify lucid interval, doctor can be charged for medical negligence. And sir, this question I have seen in many exams. It is when you are hitting at the pterion, because at the pterion you have middle meningeal artery. Middle meningeal artery. So this is a biconvex EDH, extradural hematoma or epidural hematoma, whatever you say. This is your dura and above dura है. टीरियन याद रखना, ल्यूसिड इंटरवल याद रखना, इसमें डॉक्टर पे मेडिकल नेग्लिजेंस का चार्ज लग सकता है, ये भी ध्यान रखना. But this is you can see by convex EDH. Sir, SDH. How to remember SDH? You can remember SDH. It is common in alcoholic. Yes, my dear friend. A, ये अल्कोहल पीने में कॉमन होता है. B, it is common in boxer. B, it is common due to rupture of bridging veins. B, you can add another B. It's a banana shape. तीनों B हो गए. So it's very simple. You can write down this. 3B. B, it is common in boxer. B, it's common in due to rupture of breathing vein. B, it's a banana shape. C, it is common in children. E, it is old men. It is very common. E, because of involvement of emissary veins. So anyways, sir, this is you can remember SDH, banana shape. So you can see if it is banana shape, it is concavo-convex. It is banana shape. It is concavo-convex. So how would you remember SDH? Subdural hematoma. A, alcoholic, बेवड़ों में common होता है. B, banana shape, boxer breathing with another B. C, child, बच्चों में another B. Old, बूढ़ों में another B. So B, बूढ़ा, B, बच्चा, B, बेवड़ा, B, boxer, B, breathing vein, B, banana shape. It is subdural hematoma. Sir, another intracerebral hemorrhage. Doctor Saab, most common cause of intracerebral hemorrhage is your BP is increased. So Doctor Saab, you can get a question. It is most common non-traumatic hemorrhage. Most common non-traumatic hemorrhage is intracerebral. In surgery, we use the word interparenchymal. And how to remember B for BP, PP, most common part affected is putamen. It is due to middle cerebral artery. Middle cerebral artery, intracerebral hemorrhage. Sir, motorcyclist fracture is also known as my favorite MCQ, hinge type 1 fracture. It's a fracture of base of skull. It is a hinge type 1, not hinge type 2, not hinge type 3. It is a hinge type 1. It's a fracture of base of skull. Base of skull is divided in anterior half and posterior half. So motorcyclist fracture is a hinge type 1 fracture. Hinge type 1. Sir, in pedestrian injury, you can see, I will show you this graph. This one, this diagram is important. But I will show you this one. That is primary impact. See, this is the pedestrian. This is the pedestrian. And it is hitting first time. This is primary impact. This is primary impact. So in primary impact injury, the most common affected part is leg, and that will cause bumper fracture. Leg and bumper fracture. Bumper fracture is a fracture of tibia bone. Mostly it is tibia bone. So this is primary impact. Now, sir, you are going above, it is secondary impact injury. Yes. It is, you are hitting the same vehicle, it is injury caused by glass and bonnet. So, two things. Glass or bonnet causes secondary impact, and first impact, leg, bumper fracture with tibia is primary impact. Now, sir, this favorite MCQ, secondary injury, not secondary impact, which is also known as tertiary impact. When you are hitting the ground, two possible injury, multiple graze abrasion, a tire mark, because if you go below the car or vehicle, it's a tire mark. Revise with me. First impact leg, bumper fracture. Secondary impact glass और bonnet पे अगर जाते हो तो secondary impact. Hitting the ground, multiple graze abrasion. अगर आप जैसे आपने ground पे strike किया and sliding over the ground, multiple graze abrasion, tire mark. It is known as secondary injury or tertiary impact. आदमी गलती क्या करता है? Tertiary impact is another name of secondary injury. Tertiary impact is another name of secondary injury. Most common organ caused damage by blunt trauma is spleen. By penetrating trauma, it is liver. Penetrating trauma, it is liver. By blast injury, most common is tympanic membrane. TM is tympanic membrane. By seat belt, most common is mesentery. And Dr. Saab, one question. By seat belt, we have a fracture which is known as chance fracture. Chance fracture is a fracture of lumbar vertebra. Galti karta aadmi. It's a horizontal fracture. Chance fracture is a fracture of lumbar vertebra caused by seat belt. Seat belt. Chance fracture is lumbar vertebra fracture caused by seat belt. This is another potential word. Blunt trauma, which is the most common organ damage, spleen. Penetrating trauma, liver. Blast injury, tympanic membrane. Seat belt mesentery is the most common site. But sir, you can get this question also in seat belt chance fracture. Chance fracture is a fracture of which vertebra? Lumbar vertebra, horizontal fracture. Sir, Marshall triad is common in blast injury, but this question comes in exam. Yes, this question comes in exam. Which blast injury? Marshall triad. Sir, Marshall triad is seen in secondary blast. It is seen in secondary blast. You can get a question. It is seen in secondary blast. Yes, secondary blast, not primary blast. Dr. Saab, when in Marshall triad, what is seen? Punctate abrasion, punctate contusion, and punctate laceration. And Dr. Saab, what is the mechanism of Marshall triad? Dr. Saab, I will tell you. Sir, first see these 4 blast injury. Air compression, my favorite MCQ. It is a mechanism of primary blast, shock wave. So, shock wave is there. The most damaged or most important first part to be damaged is tympanic membrane. The second would be lung. So, air compression is a primary blast. Flying missile hitting your body, जैसे मैंने बोला, Dr. I told you flying missile hitting your body, that will produce Marshall triad. So Marshall triad is a secondary blast. Flying missile जितने भी object होंगे वो आपको hit करेंगे, that's a Marshall triad, secondary blast. Hitting the ground, there will be multiple fracture, that will be tertiary blast injury. And sir, burn or flame produces quaternary blast. Quaternary blast. Air compression, primary blast. Flying missile, secondary blast. That is producing Marshall triads. जब object hit करेंगे, there will be punctate abrasion, contusion or laceration. Hitting the ground, tertiary blast, multiple fracture, and multiple burn mark, that's a quaternary blast. Marshall triad पे question आएगा, secondary blast. Sir, tardive spot are actually a petechial hemorrhage, and these are seen in asphyxial death when your oxygen supply stops and venule rupture. Venule rupture, asphyxial death, a very common spot is a tardive spot. Sir, postmortem finding of hanging. I'm talking about the external finding over the neck. Generally, ligature mark is V-shaped, oblique, or incomplete, and this injury is pressure abrasion. This injury is pressure abrasion. Doctor, when you dissect the ligature mark, there will be pale and glistening area, highlighting again and again. This ligature mark is above thyroid because it goes above the thyroid. And Doctor, what are the 2 findings of antemortem hanging? After dissection of ligature mark, pale and glistening area, what are the 2 findings of antemortem hanging? Number 1, most characteristic finding is dribbling of saliva. It is seen on opposite side of the knot. If the knot is here, the maximum pressure will be here. The saliva will be dribbled. It is a dribbling of saliva. It is opposite side of the knot. Second postmortem finding of antemortem hanging. What is the meaning of antemortem hanging? You died due to hanging. On the same side of knot, eye remain open and pupil is dilated because of cervical sympathetic chain stimulation. Dribbling of saliva on the opposite side of the knot, and if the knot is here, on the same side of knot, eye remain open and pupil is dilated because of cervical sympathetic chain stimulation. These 2 findings are antemortem hanging finding. So you can see the ligature mark, and after dissection of the ligature mark, it is a pale and glistening area. And as I told you, antemortem hanging, it is seen opposite side of the knot. La facies sympathetic, same side of the knot, pupil is dilated and eye is open. You can see the oblique ligature mark. Sometimes it is transverse also, but oblique ligature mark which is incomplete because at the site of knot it is absent. Knot की side पे absent होता है. Most characteristic finding of antemortem hanging is dribbling of saliva, and la facies sympathetic is cervical sympathetic chain stimulation. In judicial hanging, hangman knot. अब सवाल ये आता है सर, जुडिशियल हैंगिंग में हैंगमैन नोट कहां पे रखेंगे? In India, it is below angle of mandible. Below angle of mandible in India. But what about other country? The ideal site is presumed to be below chin. That's a different issue. But in India, we are putting below angle of mandible. Hangman fracture, C2 vertebra fracture. C2 vertebra fracture. An INICET sign, because of sudden drop, there is a carotid tear. This carotid tear is INICET sign. Because of the sudden drop in judicial hanging, carotid tear is there. This is MUSET sign. 3 question I anticipate in exam from judicial hanging. Sir, strangulation is not suspension. It is only constriction of neck. Only constriction of neck. What are the example of strangulation? Ligature. If you are using ligature to kill someone. Manual strangulation. Example is throttling. Bend of elbow or forearm. My favorite MCQ. If you are this is throttling and this is bend of elbow or forearm, it's a mugging. Bamboo stick, bamboo को बोलते हैं बांस के बीच में डोला. And the last is judicial strangulation, garroting. So if you are compressing the neck, ligature strangulation, you are using ligature. Throttling, mugging, बांस से डोला, garroting judicial होता है. In India we have judicial hanging, I already discussed. But in Spain and Turkey, Dr. Saab, this is in Spain and Turkey, it is garroting. It is also known as Spanish windlass. It is garroting, judicial strangulation. Sir, postmortem finding of ligature strangulation over the neck, ligature mark is transverse. In hanging, mostly it is oblique. It is at the level of thyroid. In hanging, it was above the thyroid. Here, periligature injury present, and after dissection of mark, Dr. Saab, in hanging, after dissection of mark, pale and glistening area, here you have hematoma or hemorrhage. Asphyxial signs are more prominent in strangulation, and thyroid cartilage fracture is most common in ligature strangulation. Most common in ligature strangulation. Dr. Saab, I am covering almost all topics of the forensic medicine. Sir, this is ligature strangulation. You can see this is ligature strangulation. The transverse mark and thyroid cartilage fracture is most common in ligature strangulation. Sir, throttling is always homicidal. Just remember, it is always and always homicidal. What are the external finding over the neck? Fingernail abrasion, which is semilunar or crescentic. Yes, my dear friend. Fingernail abrasion, because this is throttling, fingernail abrasion. 6 penny bruise because of the fingertip. And Dr. Saab, when you dissect the bruise, yes, my dear friend. When you dissect the bruise, again there will be hematoma. Face is congested, petechial hemorrhage and subconjunctival hemorrhage. Hyoid bone fracture is most common in throttling, but most specific fracture of throttling is cricoid fracture. This is my favorite MCQ. Most specific fracture is cricoid, but hyoid bone fracture is most common in throttling. So you can see this finding: multiple abrasion, multiple contusion, hyoid bone fracture, most specific is cricoid, nail marking, multiple bruises, 6 penny bruise. It is always homicidal, it is throttling. Sir, but same question comes, multiple bruises, fingernail abrasion over these area. Okay. Face, nose, lips and buccal mucosa with presence of asphyxial sign. Here you have multiple bruises, multiple fingernail abrasion, face, nose, lips and buccal mucosa. It is, my dear friend, none other than smothering. This is smothering. Nose and mouth both are blocked. And Dr. Saab, after bruises dissection, it is hematoma or hemorrhage. This is smothering. And my dear friend, smothering is homicidal. So, the fingernail abrasion and bruises over the neck, it's a throttling. Fingernail abrasion and bruises over the nose and mouth, it's a smothering. Dr. Saab, cafe coronary is seen in intoxicated person. And in cafe coronary, the cause of death is cardiac arrest. In cafe coronary, the cause of death is cardiac arrest. The cause of death is cardiac arrest. Sir, overlaying is accidental, but burking is homicidal. Overlaying, what is the example of overlaying? A mother comes over the child. A mother comes over the child, it is overlaying. What is burking? I will tell you, it is homicidal. If cloth piece goes in oropharynx, this is gagging and it is always homicidal. If cloth piece goes in oropharynx, it is gagging, it is always homicidal. But what is overlaying? Mother comes over the child is suffocated, overlaying. The cloth piece in the oropharynx, gagging is always homicidal. Burking, actually sir, burking is a combination of two things, very important sir. Number one, homicidal smothering and traumatic asphyxia. The person is sitting on the chest, traumatic asphyxia, and it is homicidal smothering. Dr. Saab, anyone who can remember what is another name of traumatic asphyxia? Perthes syndrome. Perthes, how to remember sir? If the परथेज पत्थर और पृथ्वी comes over, अगर हमारे ऊपर पत्थर और पृथ्वी गिर जाए तो हमें ट्रॉमेटिक एस्फिक्सिया हो जाएगा. It is traumatic asphyxia or Perthes syndrome. And Burking, I already told you, it is homicidal method. You are causing chest compression traumatic asphyxia with homicidal smothering. This combination is Burking. Doctor, now my favorite MCQ. Fresh water drowning and sea water drowning. What are the changes? Very, very important, sir. This is pulmonary capillaries. This is pulmonary capillaries. Okay. If you see the fresh water in pulmonary capillary, there will be hemodilution. But if you see the sea water in pulmonary capillary, already sodium goes up in sea water, that is hemoconcentration. So one thing is clear, here we have hypernatremia, yes my dear friend, and because of hemodilution, here we have hyponatremia. You can see here in blood vessel there is a more sodium, hypernatremia, and here because of hemodilution it is hyponatremia. Now sir, what happens next? To neutralize this is RBC. RBC liberate potassium ion, this one. So RBC liberate potassium ion, it is hyperkalemia, and here potassium is normal. Sea water में sodium होता है, it's a hypernatremia. In fresh water, it's a hemodilution, hyponatremia. To compensate hemodilution, RBC potassium छोड़ती है, RBC liberates potassium. It's hyperkalemia, that is normal. Pulmonary edema present in sea water drowning. Now, sir, because of hyperkalemia, the cause of death is ventricular fibrillation, and because of hypernatremia, the cause of death is bradycardia. Both causes cardiac arrest. Both causes cardiac arrest. So what is the cause of death? Cardiac arrest in both. Cardiac arrest. Both causes cardiac arrest. It's very simple. Both causes cardiac arrest. Now, sir, here ventricular fibrillation. VF is ventricular fibrillation. You will die in 4 to 5 minutes. And here, sir, 8 to 10 minutes. So, Dr. Saab, most of the people think the person dies earlier in seawater drowning. No, my dear friend. Person die earlier in fresh water drowning. This is cadaveric spasm. I already told you it is an antemortem event. It is immediately after death. It is primary relaxation here is absent. And mechanism of cadaveric spasm, I told you, ATP depletion. And my dear friend, this is most characteristic finding of antemortem drowning. What is AMD? Antemortem drowning. The most characteristic finding is cadaveric spasm. Cadaveric spasm. Sir, this finding, this can be present in antemortem drowning and postmortem drowning. This is washerwoman hand. Washerwoman hand. So, any change in the palm and sole, this is seen in antemortem as well as postmortem drowning. Both, it is a non-specific finding. But sir, mucoid froth, because the water mixed with the mucoid froth, which is white, leathery mucoid froth from nose and mouth, it is a antemortem drowning finding because the water mixed with the mucus. Water in GI tract, again a very important finding. Mud particle in trachea and ditums from bone. So you can remember ditum from bone. Ditums are unicellular algae. So ditums from the bone, frothing from the mouth, which is a mucoid frothing, mud particle in GI tract, and ditums in the bone, and everything which is indicative that water entered in your body is a finding of antemortem drowning. These all are the findings. But sir, this washerwoman hand is non-specific finding which can be present in antemortem as well as postmortem drowning. Most characteristic finding of antemortem drowning is cadaveric spasm. What is antemortem drowning? You died in water. You died in water. Now sir, P for Pultoff hemorrhage, P for pulmonary hemorrhage, P for subpleural hemorrhage. P for Pultoff, P for pulmonary subpleural hemorrhage. It is seen in drowning. It is seen in drowning. Sir, postmortem staining color. I already told you today, like postmortem staining is independent part. Carbon monoxide, cherry red color, CC. Cyanide, it is brick red color. Very, very important, sir. Cyanide, it is brick red color. In hypothermia, it is bright pink color. Hydrogen sulfide, H2S. How would you remember 2 color, bluish green. Opium, it is black color. Hypothermia, it's a bright pink color. Now, sir, remember P, A, and pan. How would you remember this? P phosphorus, A aniline, and nitrite. P, A, and pan. In pan, it is chocolate brown color. In pan, it is chocolate brown color. So these are the color of postmortem staining. Okay, so I think like carbon monoxide cherry red or bright or brick red. Sometimes they don't give the word bright. They can give the bright or brick red, both. ब्राइट पिंक हाइपोथर्मिया, ओपियम ब्लैक कलर, ओपियम का ध्यान रखना ब्लैक कलर, H2S में 2 हाइड्रोजन सल्फाइड 2 कलर, पान फॉस्फोरस एनिलीन एंड नाइट्रोजन इट इज chocolate brown color. Dr. Saab, Casper dictum formula was given by Taylor. It is the rate of decomposition in air, water and soil. And if you see the maximum rate of decomposition in air, if in air you decompose in 1 week, water will take 2 weeks and soil will take 8 weeks. This formula is known as Casper dictum given by Taylor. Dr. Saab, for race we use syphilic index. How would you remember? RACE, race, C is syphilic index. It is an index of skull bone. It is breadth divided by length of skull bone into 100. Sir, we can remember by DUMB, dumb. That's a trick. Or you can remember by a Hindi trick, दूध मिष्टान भंडार. या तो डम से याद कर लो या दूध मिष्टान भंडार से याद कर लो. What is this? D for dolichocephalic, M for mesaticephalic, B for brachycephalic. Dolichocephalic value is 70 to 74.9. Mesaticephalic 75 to 79.9 and brachycephalic 80 to 84.9. सर डोले शोले निग्रो में होते हैं और प्योर आर्यन में होते हैं. इफ यू आर प्योर आर्यन एंड निग्रो यू हैव डोलिकोसेफेलिक. Mesaticephalic, MICE, mice, that's a trick to remember. I for it is Indian, C for it is Chinese and E for it's a European. Indian has mesaticephalic and brachycephaly is seen in Mongol. Brachycephaly is seen in Mongol. So, Dr. you can see the Indian cephalic index is in mesety. Sir, there are some differences in male and female bones. Sir, Ashley rule is for sternum. How to remember? A for Ash for Ashley, S for sternum. In male, sternum length is more. That's Ashley rule. Sir, all bony prominences are more prominent in male except two bony prominences. F for female, F for frontal और female परी होती है parietal. F for female, F for frontal और female परी होती है parietal. These two bony prominences are more prominent in female. Preauricular sulcus is more commonly present in female, not present in male. In male it is absent, rare. Obturator foramen देखो OT, O पहले आया ना. Obturator foramen oval, T triangular. T triangular, OT, oval and triangular. In female, all things are round except obturator foramen. Best index for male or female. Index value is more in female. And best bony index is sciatic notch index. Just remember. Best bony index is sciatic notch index. Pelvic inlet in male is heart shape. In female, it is oval shape or round shape. Pelvic inlet in male, it's a heart shape. If you get a question, heart shape pelvic inlet in male. All Ashley S sternum. All bony prominences are more prominent in male except frontal and parietal. F for female, F for frontal, परी लगती है parietal. Best bony index, sciatic notch index. Preauricular sulcus present in female. Obturator foramen OT, oval, male, T, triangular. Pelvic inlet is heart shape in male. Sir, for age of fetus by using crown heel length, we use a rule. For first 5 months, we use rule of Hasse. For next 5 months, we use Morrison rule. What is first 5-month rule? Month is equal to under root of length in centimeter. That is a crown heel length. And for next 5 months, that is month is equal to length by 5. Month is equal to length by 5. This is देखो डॉक्टर साहब पहले 5 महीने में फीटस हंसे, फर्स्ट 5 मंथ फीटस हंसे और इसके बाद अगले 5 महीने मोर इज लेस मोर देन 5 मंथ, मोर देन 5 मंथ. फर्स्ट 5 मंथ और अप टू 25 सेंटीमीटर वी यूज. देखो पहले 5 महीने में फीटस हंसे रूल एंड नेक्स्ट 5 मंथ मोर देन 5 मंथ इट्स अ मॉरिसन रूल. मोर देन 5 मंथ इट्स अ मॉरिसन रूल. दैट्स अ ट्रिक टू रिमेंबर. Consent is given in Indian Contract Act, doctor and patient relationship. First consent, if it is verbal or written, it's express consent. But if it is consent given by gesture or act, if you are not giving verbally or written by gesture or act, example, doctor is recording BP of a patient. It is a consent given by gesture only. It's implied consent. The best consent without any doubt is written informed. The best consent is written informed consent. Best consent. Sir, in single consent, if you are covering multiple procedure, you are taking single consent but covering multiple procedure. It's a blind blanket or open consent. It is not valid in India. It is valid in USA. You are taking one time consent, but you are going for all procedure. It's a blind blanket or open consent. If in place of you, your family member gives you consent, it's a substituted consent. So negligence is of two types, civil and criminal. Civil is also known as tort. What is civil negligence? Mild. And what is criminal? Gross negligence. If you see, civil negligence is mild negligence. Criminal is gross, it can cause death. In civil negligence, burden of proof toward the patient. In criminal negligence, burden of proof towards the doctor. Doctor needs to prove in criminal and patient needs to prove in civil. Here punishment is money, but here sir money plus 304A IPC. Here trial is in civil court. Here trial is in criminal court. Trial in civil court, trial in criminal court. Example, drug overdose causing side effect. Drug overdose causing side effect is civil, and my dear friend, after surgery you left instrument in the body, that is criminal. Look, sir, these are civil and criminal negligence. I have seen a question. Burden of proof in civil is patient, burden of proof is criminal. Now, sir, in rifled weapon, how to differentiate contact, close, near, and distant shot? Sir, muzzle impression. This is muzzle impression. It is only present in contact shot. In all remaining shot, it is absent. Muzzle impression is absent. Shape of the wound, if it is stellate shape, yes, it is contact shot. All remaining, it is circular. Only contact shot has a stellate shape because this is near. Sir, blackening, burning and tattooing. Sir, burning is because of flame effect. Blackening is because of smoke effect. Tattooing is because of gunpowder. Burning is burning of hair, flame. Smoke produces blackening, and tattooing is because of gunpowder. These three absent in contact because everything goes inside the track. These three present as BBT, burning, blackening, or tattooing. Burning is also known as singeing. Okay, so these three present in close shot, only burning and tattooing, or sometime only tattooing in near shot, and in distant shot, all three absent. Sir, abrasion and grease collar, because abrasion and grease collar are because of entry wound, like if something strike, these present in all three, all four. Again, I'm revising. Muzzle impression, contact shot. In contact shot, it is stellate, all remaining it's a circular. In contact shot, burning, blackening, and tattooing will be absent. Everything goes inside the track. In close, it will be present. All three present. All three present. In near shot, what present it is? Burning, blackening, tattooing, but sometime only tattooing. Blackening, tattooing, not burning, because flame effect disappears. So in near shot, it is blackening plus tattooing, or sometime only tattooing. In distant, everything will be absent. And abrasion and grease collar present in all four, because abrasion and grease collar is because of the entry goes inside. Sir, bullet fingerprint, you can get a question. Bullet fingerprint is primary marking as well as secondary marking. Primary as well as secondary marking. What is primary marking and what is secondary marking? Sir, primary marking decides the class of weapon, and it's a gross marking. It is because of rifling of marking. What is rifling? Land and groove. So, according to land and groove, the marking is provided. That is primary marking. It is class characteristic. Secondary marking is individual characteristic and it is a microscopic marking. It is because of irregularity inside the barrel. Listen very, very carefully. Primary decide the class, secondary is individual marking. Primary is because of land and groove, according to land and groove. Secondary is because of irregularity inside the barrel. Secondary is microscopic, so microscopic marking is secondary. Bullet fingerprint is both. Sir, how to remember the shotgun? You can remember shotgun fires the pellet. In contact shot entry wound, it is tilted shape. And after this, you will remember a trick ORS. ORS. O, oval shape or round shape when it is less than 1 meter, close range. R, rattle shape, 1 to 2 meter. S, satellite, one large surrounded by individual pellet, 2 to 4 meter. And individual pellet entry wound. Individual pellet entry wound when it is more than 4 meter. Muzzle impression only present in the contact shot, all remaining muzzle impression absent. So how to remember? Again same stilette shape, then ORS. O look like round, R rattle, S satellite. An individual pellet is seen when it's a more than 4 meter. ORS, that's a trick to remember. Sir, ideal homicidal poison is thallium and most commonly used is arsenic and aconite. Very common 2A. Most common. Ideal is thallium. डॉक्टर साहब थेलियम हाउ टू रिमेंबर? थाली में देखो, थाली में आलू पूरी सब्जी, थाली में मीज लाइन, आलू एलोपेशिया, पूरी पोलिन्यूरोपैथी, सब्जी स्किन रैश. तो थाली में आलू पूरी सब्जी, दैट इज ए थेलियम पॉइजन. आइडियल सुसाइडल पॉइजन इज साइनाइड. मोस्ट कॉमनली यूज सुसाइडल पॉइजन इज इंसेक्टिसाइड. देखो, ideal homicidal poison is thallium. Most commonly used is 2A, arsenic or aconite. But ideal suicidal poison is cyanide. Most commonly used suicidal poison is insecticide. Sir, in toxicological analysis, the most commonly used preservative is common salt, but the ideal preservative is rectified spirit. Both questions are very important. Most commonly we use common salt because it's a cheap product, but ideal is rectified spirit. For blood, the best preservative is sodium fluoride. For urine, the best preservative is toluene. अब आप गलती करो ना, तो how to remember? Urine sound like a toluene. Urine, toluene. For histopathology, the best preservative is formalin. For virology, the best preservative is glycerine or glycerol. For virology, the best preservative is glycerine or glycerol. So now the few poison and the specific smell. The ethanol gives fruity smell, fruit-like smell. A for aldehyde, acrid smell, and I have seen one question of para-aldehyde, acrid smell. Rotten egg, very important smell. Sewer gas smell is H2S, hydrogen sulfide. Rotten fish, aniline smell. But one of my favorite MCQ, organophosphate. It's a kerosene-like smell, organophosphate. Fishy smell, zinc phosphide. Now 2B, 2C. Very simple trick. B has C. After B, C. Bitter almond smell, cyanide. Burnt off smell, cannabis. Burnt off smell, cannabis. Shoe polish. Which shoe you like? Nike, nitrobenzene. Garlicky smell. We can remember by garlic pizza. P for pizza, P for phosphorus. P done. Garlic. AR is arsenic and garlic pizza in thali, thallium. Garlic pizza. E phosphorus. This is thali, thallium, arsenic. These are the poison and the smell. Universal antidote, you can remember by a trick. Universally what is present? ATM, activated charcoal, tannic acid and magnesium oxide. So you can remember the ratio of ATM is 2:1:1. This is universal antidote. ATM. Universal antidote is ATM. Coma cocktail. How to remember? When you appear for DNB1 exam, DNB exam first time, you will go in coma. D for dextrose, N for naloxone, and B for vitamin B1. That's a thiamine. And you can remember this is naloxone is used for opium comatose patient. Opium. Vitamin B1 for ethanol. This is coma cocktail. Dextrose is for hypoglycemic coma. Hypoglycemic coma. Antidote in different poisoning. One question in every exam comes regarding the antidote. Paracetamol, it is N-acetylcysteine. Methanol, it's a fomepizole. Fomepizole inhibits alcohol dehydrogenase. This is my favorite MCQ. Carbon monoxide, that is oxygen. Benzodiazepine, it's a flumazenil. Opiate, I already told you it is naloxone. Organophosphate, it is atropine and oxime. Atropine and oxime for organophosphate. Cyanide, the best antidote is vitamin B12, but we also use amyl nitrite, sodium nitrite, and sodium thiosulfate. Triple antidote. For cyanide, we use triple antidote. Eli Lilly antidote. Triple antidote. Thallium, थाली में पिज्जा, Prussian blue, this is antidote of thallium, and meth hemoglobinemia, methylene blue. These are the antidotes generally being asked in your exam. Next, sir, arsenic, AR. The first two letters are AR. Eldritch means line present in arsenic. A. R. Red velvety mucosa, that is R. R. Raindrop pigmentation. So you can see this is Eldritch means line. And Eldritch means line, I already told you today, it is also present in thallium poisoning. But you can remember AR, Eldritch means line, R, red velvety mucosa, and raindrop pigmentation. Last two are IC. I, the antidote of arsenic contain iron, that is ferric hydroxide. Ferric hydroxide. Hydrated ferric oxide. Arsenic look like a disease, that's a cholera. That is cholera. Sir, remember, my dear friend, lead. Actually, if you see the last two letter of lead, AD, lead inhibits LR dehydratase and lead inhibits LE ferrochelatase. Two enzymes are inhibited by lead, ferrochelatase and LR dehydratase, not LR synthase, LR dehydratase. In adult, if the lead level is this, and in children, if the lead level is this, if we have encephalopathy, we use BAL plus ADTA. See, the blue line in the lead is Bertonian line, BB, and blue dot in RBC, not in basophil, it's a basophilic stippling. Children without encephalopathy, we use DMSA, which is also known as succimer, This is my favorite word, sir. These are the root of aconite, and this is blue rocket or meetha zahar. This is aconite, blue rocket, meetha zahar. There is a classical sign, contraction and dilation of pupil. This is Hippus sign. This sign is known as Hippus sign. And there is one more word. This question comes in exam, that is xanthopsia. This is also in aconite poisoning, a cardiac poison. The most common electrolytic problem in the aconite is hyperkalemia. These are roots most toxic. Cannabis, you can see the dry leaf of the cannabis causes formation of bhang. The sweet product of bhang is mazoon. It is sweet, honey and something is added in bhang. Charas, ras is resin. Female flower is used for making ganja. These are the product of marijuana. Bhang, cannabis, ganja, charas. Run amok is homicide followed by suicide by bhang. That is cannabis, run amok. What are the name of cocaine? C cocaine, C crack, C coke, all are 3C. C for she. And if we are using she, then it's a white lady. And white, what is the color white? Snow. These are 6 names of cocaine. C, she, white lady, snow. Magnan symptom is tactile hallucination. It is a tactile hallucination. Antidote of cocaine is amyl nitrite. Another very potential word. Cocaine mechanism is it's a sympathomimetic cell. Everything is increased. BP, heart rate, respiratory rate, all are increased. Nasal swab is the sample which is taken For cocaine poisoning, E plus she is a speedball. She is cocaine without any doubt. E for heroin. लोग साहब अगर ही और शी मिल जाए तो स्पीड ऑफ बॉल बढ़ जाती है. E plus she, heroin plus cocaine. Sir, heroin is a semi-synthetic product. It is a diacetyl morphine, and if you smoke the heroin, that on aluminium foil, this word is chasing the dragon. Smoking the heroin is known as chasing the dragon. This is poppy fruit, sir. Blue-green color fruit, different fruit, poppy fruit, opium. Pinpoint pupil is seen in comatose patient with respiratory depression. This is opium, afim, and the morphine is one product, and diacetyl morphine is heroin, and the antidote is naloxone. Antidote is naloxone. Scorpion and spider. Scorpion and spider. These are the four similarity in scorpion and spider. Number one, both belong to arachnida group. Number two, both have 8 legs. Both have neurotoxin and both have priapism. What is priapism? Painful erection of penis. But sir, in spider we have D, we give dapsone, and scorpion we give alpha blocker prazosin. Here we use anti-scorpion venom, here we use anti-spider venom. This question comes in exam that autonomic storm is very common in scorpion bite. What is autonomic storm? Sympathetic as well as parasympathetic stimulation. This combination is known as autonomic storm. So sometimes a question comes, autonomic storm is a very important feature of scorpion bite. This I already told you. Primary impact injury, leg is the most common. Then you go to the glass or bonnet, that is a secondary impact, and then you are hitting the ground. And I told you two injury, that's a tire mark or multiple grazed abrasion. Tertiary impact. Tertiary impact, another name is secondary injury. Sir, so I told you bumper fracture, primary impact, tire mark, tertiary impact. Tertiary impact is also known as secondary injury. And multiple grazed abrasion is another tertiary impact. Remember, sir, primary impact, secondary impact, tertiary impact is a secondary injury. Tertiary impact is a secondary injury. Sir, frostbite is a hypothermia, and it is seen when the temperature is minus 2.5 degrees centigrade. Most common affected site is nose, minus 2.5 degrees. Sir, if this was frostbite, it's a hypothermia, but if it is hyperthermia, and in which hyperthermia sweating become absent when the temperature goes beyond 40.5 degrees centigrade, this condition is heat stroke, sunstroke, and in our language it is known as lu lagna. Heat stroke, sunstroke. So, Doctor, if you get a question, in which hyperthermia sweating is absent, heat stroke or sunstroke? Heat stroke or sunstroke? Sir, this is a moist burn, scald, and this is a dry burn, flame. When do you start feeling burn? 44 degrees centigrade. You start feeling burn at 44 degrees centigrade. Sir, when liquid and steam above 60 degree, that is scald, and in scald we have sodening and bleaching present. Sodening and bleaching present on scald. Here in dry burn, sodening and bleaching absent. Dry burn is a flame burn. So in flame burn, there will be blackening present as well as burning present. Burning of hair is a singeing of hair. That is a dry burn. That is a dry burn, flame burn. Now, sir, this is pugilistic attitude. Pugilistic attitude is also known as boxing attitude. Sir, two question comes in exam. The mechanism of pugilistic attitude is coagulation of muscle protein. This is attitude like this attitude. And my dear friend, this can be present in antemortem burn as well as postmortem burn. So it is a non-specific finding. And it is commonly seen when the temperature is more than 65 degrees centigrade. Most characteristic finding of antemortem burn is soot particle or carbon particle in trachea, but pugilistic attitude or boxing attitude is not a characteristic for antemortem burn. It is seen in both antemortem or postmortem both. Now, sir, heat rupture. Rupture, this is because of dryness of skin, heat rupture. It is seen in skin and joint. Margins are irregular, that's why it look like laceration. That's why it looked like laceration. But how would we differentiate? It's not laceration, it's a heat rupture. Here, base is pale and blood vessels and nerves are intact. Base is pale, blood vessels and nerves are intact. Electrocution, we have first burn, Joule burn. Joule burn is actually an entry burn. You can see the endogenous burn, that is a Joule burn. It is just like a crater and the base is pale. Base is pale. And observe, the most resistant structure of your body for any kind of burn is dry skin. Second is bone. And Joule burn is commonly seen when you have low voltage and firm contact. Low voltage and firm contact. Low voltage and firm contact. Sir, if you have high voltage and loose contact, you have multiple pitted burn mark. Multiple pitted burn mark, it's a crocodile burn. Low voltage firm contact, Joule burn, J for Jhatka, J for Joule burn. High voltage loose contact, crocodile burn. Sir, strychnine is nux vomica or cuchilla. Strychnine is nux vomica and cuchilla. It is also known as dog button, used to kill dog. Fatal dose is 1 crush seed. The seed are concavo-convex. 1 crush seed, dog button, dog को मारने का मतलब कुचीला और नक्स vomica. It act on the spinal cord, anterior horn cell, and it look like it mimics a disease. That arsenic mimics a cholera, it mimics tetanus. And sir, there is a condition which is ophistotonus. Ophistotonus is hyperextension of back, just like bow-like position. It causes clonus, tonus. That is very, very important. Strychnine, 1 seed. This is ricinus. 10 seed are the fatal dose, my dear friend. And observe, 10 seed is a fatal dose. This is ricinus. It is also known as castor plant and arundi. You can see the small shiny seed. Castor plant and arundi. 10 seeds are fatal dose. Now, sir, here the main principle is ricin. R for ricin. It inhibits RNA polymerase and inhibits protein synthesis. The mechanism is RBC agglutination. Sir, it is a category B biological warfare agent. It is category B biological warfare agent. This is croton. Croton is also known as Napala or Jamal Gota. Gota. So, fatal dose are 4 seed. देखो, strychnine 1 crush seed. Ricinus 10 seed. Jamal Gota. Gota से चौका मारना है. That is 4 seed are the fatal dose. These are the Napala. Croton Tigelium, this is Napala or Jamal Gota. 4 to 5 seed is a fatal dose. The main active principle is crotin. It's a poisonous. Sir, this is Rati, Abrus. This is Rati, Abrus, rosary bead, or the main principle is abrine. It's a red seed with black tip. Rati, rosary bead, and abrus. Abrine act like viper venom. Abrine act like viper venom. This is Rati. You can see so many questions. The fatal dose is 1 to 2 seed. 1 to 2 seed. Sir, it is a ideal cattle poison. We take sui and the length of the sui is generally 15 mm, or it is size is needle and sui we put on the cattle. It's abortion. Everything is a animal poison, abortion poison, arrow poison. This is Abrus precatorius. Treatment is gastric lavage with anti-abrine. So just remember it is Abrus precatorius, animal and arrow poison. This is Semicarpus anacardium. It is also known as marking nut. It is also known as bilava. And here seed look like heart shape. This question comes in exam. Heart shaped seed are Semicarpus anacardium. This Semicarpus anacardium. This is marking nut or bilava. I have seen many times question. Bilava is another name of Semicarpus anacardium. देखो नाम में कार्डियम है, heart shape होता है. Semicarpus anacardium. Bilava. Doctor Saab, the active principle is semicarpol and bilavanol. It is used to produce artificial bruise. It is used to produce painful blister, and it is enclosed. It is used for marking. That's why it is known as marking nut. Fatal dose is 5 to 10 gram. It is semicarpus. This is Calotropis acro madar. This is a very important plant. Calotropis acro madar. It is also known as rubber bush, ush. The active principle is usherin. One active principle is calotoxin, that is calotropis. But usherin is active principle. This is Calotropis zizantia and Calotropis procera. Procera is white and zizantia is purple. And it is used as an accidental poisoning, artificial bruise. It's a very common cattle poison. Another cattle poison is this Calotropis. Calotropis. Artificial bruise is also. Conjunctivitis. Dilated pupil is seen. So this I made a trick ABCD. Dilated pupil. Thorn apple is Datura stramonium. Doctor, this is thorn apple, Datura stramonium. You can see the thorn, Datura stramonium. Sir, seed. If you see the seed are brown color seed. You can identify Datura seed by brown color. Datura is an anticholinergic plant. Fatal dose is almost 100 seed, 100 to 125. And the main anticholinergic principle is not atropine, it's a hyoscine. Galti kya karte log atropine. It is anticholinergic but not atropine, it's a hyoscine. It's a delirium poison, 9D poison. Dryness, drunkenness, diplopia, many D. 9D poison. It is very commonly used railway side and roadside poison because it causes delirium. An antidote is physostigmine. All the images comes in exam. It is Datura. For Datura, this word comes in exam. What is this word? Yes. Blind as a bat, hot as a hare, dry as a bone, red as a beet, and mad as a wet hen. This is none other than Datura. ये पांचों स्टेटमेंट आपको याद रखना है. Physostigmine is anti. Which tragedy is because of which intoxication? My dear friend, which tragedy is because of which intoxication? The answer is methanol. Which tragedy is because of methanol poisoning? Illicit liquor. Which tragedy? Methanol. Looks like CH for chili seed. You can remember CH. C for capsicum. H for Onan hand is a dermatitis caused by chili seed. These are yellow color. Dermatitis by chili seed is Onan hand. Looks like now I am coming to snake poisoning. King cobra is the most fatal snake. The reason is the king cobra eats snake. That's why the name is Ophiophagus. Cobra is a nag. Nag is naja. That's a trick to remember. Nag, naja. This hood contains spectacle. This hood of the cobra contains spectacle. Both have hood. King cobra is Ophiophagus and cobra is naja. Both are neurotoxic. One more neurotoxic snake is common kareth. Common kareth is Bangarus, and cause of death in all neurotoxic snake is respiratory muscle paralysis. RMP is respiratory muscle paralysis. That's why, sir, what test is done for this neurotoxic snake? Breath count test. Neurotoxic snake. So, how many Bangarus? Bangarus what? Bangaru toxin is a neurotoxin. So, 3 snake are neurotoxic. 1, 2, 3. Cobra, king cobra, and common kareth. Now, sir, V for viper, very simple. V for vasculotoxic. Done, sir. V for viper. V for vasculotoxic. And doctor, how to identify the viper? 3 rows of brown shaped scale. You can see. The one on the top, 2 on the lateral. These are diamond shape. Can you see the shape? Diamond shape, 3 rows of the brown color scale. This is V for viper, V for vasculotoxic. Bleeding will be there. S saw scale viper. And doctor, this is having angulated scale. Can you see the angle? Angulated scale, and it's a coiled around. The snake is generally coiled around. It's angulated. Brown scale Russell viper, and this is angulated scale. Or scale. Sir, maximum local symptom is present in viper. Minimum local symptom is present in kareth. Both question comes in exam. Clot test is done in viper because it affects your bleeding. And viper treatment. Yes. When you have systemic bleeding and very profuse local bleeding, for viper treatment, we use anti-snake venom first, without any doubt. Second, for bleeding, fresh frozen plasma. And third, surgical debridement. So this is a combination of, what is the combination here? Anti-snake venom, fresh frozen plasma, and surgical debridement. This is for viper. Now for kareth and neurotoxic, I will tell you, don't worry. Sir, treatment of snake poisoning, listen. First is for cobra. For cobra, we use anti-snake venom plus mechanical ventilation, because I told you respiratory muscle paralysis is seen. But sir, along with this, in cobra, we use neostigmine plus atropine. Now, why do we use neostigmine and atropine? Neostigmine act at the postsynaptic cleft and the cobra toxin act at the same place. And atropine is just to counteract the side effect of neostigmine. ASV anti-snake venom is given by ISV. Now, viper treatment, I already told you ASV, fresh frozen plasma and surgical treatment. In Kareth, we don't use neostigmine and atropine. The reason is, in Kareth, toxin is at presynaptic cleft. Here we use anti-snake venom and mechanical ventilation, no neostigmine, no atropine. And what is the strategy for snake? Strategy for snake poisoning, right? R, reassure. I, immobilize. G, go to hospital. H is history taking and T is a treatment. Revise with me. R, reassure. I, immobilization. G, go to hospital. T, G, H, T. T, treatment has to be started. H, history proper taking. So, Dr. Sir, this is right. Very important word. Sir, this is sea snake. S for sea snake, S for skeletal muscle. It is a myotoxic, but ultimately it leads renal failure. And Dr. Sir, there is a flat tail. This help in the pedaling. And because it is myotoxic, when the muscles are gone, it can lead kidney failure. And there is a one word, rhabdomyolysis. If you get a question, rhabdomyolysis is seen in sea snake. S sea snake, देखो, V viper, V vascular toxic. S sea snake, S skeletal muscle paralysis, myotoxic. Sir, this is BB. When BB comes in your life, BB is blister beetle. It is a Spanish fly. Very, very important, sir. And it causes canthrid poisoning and priapism. BB, blister beetle, canthrid poisoning and priapism. Doctor, how do you go for dental charting? Now, sir, if you see, how do we write down the dental formula? Dental charting. How do we go for dental charting? This is right side, left side. Sir, the first method is, listen very, very carefully, Palmer notation or Zsigmondy method. Paji, you can remember by Paji, Palmer notation and Zsigmondy method. So, if we write down the teeth 1 to 8, yes, 1 to 8, 1 to 8 and 1 to 8. We write down in very simple, starting 1 to 8, 1 to 8, 1 to 8, 1 to 8. This is for permanent teeth because we have 32 permanent teeth. This is Palmer notation or Zsigmondy method. For temporary teeth, we don't write down 1 to 8, we write down A, B, C, D, E, A, B, C, D, A, B, C, D, E, A, B, C, D, A, B, C, D, A, B, C, D. This is a Palmer notation. But you just remember 1 to 8, 1 to 8, 1 to 8. Paji, Palmer notation, Zsigmondy method. But if along with upper teeth, if we write down plus, and along with lower teeth, if we write down minus, see, plus 1 to plus 8, plus 1 to plus 8, minus 1 to minus 8, minus 1 to minus 8. This is Hadrup. Hadrup. 1 to 8, 1 to 8, 1 to 8, Palmer notation or Zsigmondy. Plus 1 to plus 8, ऊपर वालों के साथ plus, नीचे वालों के साथ minus. Lower one, it's a minus. It's a Hadrup formula. Sir, if we use 1 to 32 number, 1 to 8 was Palmer notation, plus minus Hadrup. If we add 1 to 32, this is right side and this is left side. So if I start 1 to 8, then 9 to 16, then 17 to 24, 25 to 32, this is known as universal or Cunningham method. Universal or Cunningham method. For temporary teeth, we use later, like alphabet, A, B, C, D, E for temporary. But it is 1 to 32. If the 1 to 32, now Dr. How do you get the question? If 1 to 8, 1 to 8, 1 to 8 number are given, it's a Palmer notation or Zsigmondy, plus minus are given, Hadrup, and 1 to 32 number is given, it is universal or Cunningham method. Now, sir, two more method, FDI and modified FDI. How to remember, sir? In FDI, you just see the quadrant number 1, 2, 3, 4 quadrant. See, 1, 2, 3, 4. It is just like Palmer notation. It is just like Palmer notation. 1 to 8, 1 to 8, but we are adding the number of quadrant also. This is number 1 quadrant right side. So I will add 1. 1, 1 to 1, 8. This is second. 2, 1 to 2, 8. This is third. 3, 1 to 3, 8. This is fourth. 4th, 1 to 4, 8. So if I'm adding the number of quadrant also, if we have 4 quadrant, first quadrant, second quadrant, third and fourth. First quadrant 11218, second quadrant 21228, third quadrant 31238, fourth quadrant 41248. It is FDI formula. The name is given Federation Dental International. Now sir, modified FDI is almost same, but only difference 1, 2 same. But in FDI it was 3 and 4. Here it is 4 and 3. We are exchanging 3 and 4. 1, 2, 4, 3. This is modified FDI. Dr. Saab, again I am revising all 5 dental formula. 128, 128, 128, 128. Common notation Jigmondi. Plus 1, 2 plus 8, minus 1, 2 minus 8. Add up. 1 to 16, 17 to 32, universal Cunningham. Now number of quadrant I am adding. 1, 1 to 1, 8, 2, 1 to 2, 8, 3, 1 to 3, 8, 4, 1 to 4, 8. It is FDI. 1, 2, 4, 3. It's a modified FDI. Let's change it. Now, sir, the best identification in method is dactylography or Galton system. Fingerprint. Actually, it is fingerprint. First fingerprint bureau in Kolkata. Fetus 12 week में fingerprint बनना start हो जाते हैं. At 24 week, it gets completed. Minimum how many fingerprint or how many points should be similar? 10 to 12. Fingerprint are permanently lost in this condition. Leprosy, radiation, electric burn. And sir, what are the type of fingerprint we have? Love, wife and children. Love loop variety, wife whirl and arch, children composite. Love loop, wife whirl and arch, and this is composite. Most common is loop and least common is composite. Composite is a mixed variety. Okay, now sir, sometime you can get a question how to identify the fingerprint. Sir, one word comes or. When fingerprint converge towards each other like this, this is core. And when there is a meeting point from three direction, I'm revising this. When you have the meeting point from 3 direction, this meeting point is known as delta. Delta. If the meeting point from 3 direction, it's a delta. And if fingerprint converge towards each other, it's a core. Now, listen. Loop variety look like a hairpin. Very simple. Arch is just like a mountain. And whirl is just like a circle. But how would you identify by core and delta? See, in loop variety, if you see very, very carefully, it is one core. It is one core because it is convergence. And it is a meeting point from 3 direction. It is one delta. One core and meeting point from 3 direction, one delta. But sir, if you see this one, in arch, plain arch, it is no convergence and no meeting point from 3 direction. So you can see no core and no delta in arch. Now, in whirl variety, you can see this is circle. So this is convergence. And these are 2 meeting points from here from 3 direction. Yes, it is. This and this. So we'll have 2 delta. Yes, my dear friend, we'll have 2 delta and probably 1 or 2 core. Maximum it is 1 or 2 core. So you can see 1 or 2 core. And so here I am writing down either 1 or 2 core. This is core convergence and 2 delta. This is 2 delta. So this is in whirl variety. Doctor, if you go in detail, you can get this question in your exam. And my dear friend, this is all about LRR. Thanks and best of luck for your exams. This is very important LRR. I tried to cover maximum topics in this LRR. Okay. Good luck. Goodbye.